Now we'd like to talk about insertion of the iGel O2 airway. Insertion should be a relatively simple process. The airway is meant to deflect off the hard palate into the lower pharynx. It does require a rather specific pre-lubrication regimen. If we don't lube this properly, the device placement becomes very, very difficult. The first step of this process, of course, is determining the proper size for the patient. Here in Kalamazoo County, we're going to be utilizing the 3 adult sizes of the iGel. Number 3, which is a yellow cuff, number 4, which is green, and 5, which is orange. Now, these are a weight-based measuring system. We kind of look with the ideal weight for a patient. Number 3, which is a small adult, 30 to 60 kilograms. The number 4, the medium adult, at 50 to 90 kilograms. And the number 5, which is 90 plus kilograms. You see the picture on the right. They come prepackaged with the airway. Also in there is the securing strap and a small amount of lubricant. It is important to note that packaging is in a semi-rigid plastic. It's important that that doesn't become damaged while it's being stored prior to use. Continuous pressure on the iGel airway could potentially deform that cuff and render it useless when we go to put it in. Now we've figured out what size we want to use, we want to go through and inspect the airway, inspect the packaging, make sure the packaging is not damaged, make sure it hasn't been crushed. Pull out the airway itself and inspect that bowl, make sure that the surfaces are flat and smooth and intact. Make sure that the gastric channel is patent and open. There's nothing plugged up in it. We want to discard that device if the body or the tube is abnormal or looks deformed. Pre-lubricating the airway again is very important. There is no inflatable cuff, so the airway is already at its proper size. And in order to make sure we get a clean insertion, we need to go through the specific lubrication process. The way we do that is we take a small bolus of the lubricant, which is provided, and we put it on the inner side of the main shell of the packaging. Now we'll grasp the iGel O2 along the bite block, and we want to lubricate first the back side of the cuff, which would ride along the hard palate and into the upper airway. We want to make sure and lubricate the sides of the cuff, and finally the front face of the cuff at the tip. Once we've done that, we need to check and make sure there's no bolus of lubricant in the bowl or up in the lumen of the airway. And we need to make sure that the supplementary oxygen port is firmly closed so we don't get leak. Prior to insertion of the iGel airway, we need to make sure that the patient is pre-oxygenated. This is an important step no matter what advanced airway we're using. It's also a good time to go through and check their lung sounds when we're using a bag valve mask and an OPA. Make sure they're clear and equal. Make sure we have breath sounds on both sides. That way we have a good starting point to help understand our airway conformation findings. We need to determine if that patient might have a difficult airway issue. Maybe with the iGel, the patient is at the wrong weight category. We need to make sure that we have the right size. And we want to ensure that we have continuous monitoring of PO2 at this point. The insertion process, we want to grasp that iGel O2. I want to position the device so that the cuff is facing towards the chin. The patient should be in a sniffing position, noted in the figure, with the head extended and the neck slightly flexed. The chin needs to be gently pressed down, opening the mouth by an assistant prior to inserting the iGel O2. We want to introduce the leading soft tip into the mouth of the patient, directing it towards the hard palate. You see the picture in the upper right. They're not coming straight into the oropharynx. They're actually guiding towards the hard palate. We want to glide the device downwards and backwards along the palate in a continuous gentle push until a definitive resistance is felt. Once it is, the tip of the airway should be lubricated in the upper esophageal opening and the cuff, again, located against the laryngeal framework. The incisor should be resting at the integral bite block. There is a mark on the device help us ensure that we're at the right level. The last step, the strap slid under the patient's neck and one end attached to each side of the hook fastening device at the top of the airway. And some adjustment may be needed to ensure we have optimal positioning. We want to make sure to have a firm pull on the airway, but that we're not over tightening it. Here we see a quick video of the insertion. The assistant pushing the chin down to open the mouth, the device coming in, aiming at the hard palate. We follow the natural curvature of the patient's anatomical airway. The eye gel should ride around the corner. And finally, the tip seating in the esophageal opening. There's a gastric tube for suctioning in the eye gel. It can be cannulated with a flexible suction tip. The number 3 and number 4 eye gels, you can use a 10 French suction catheter. The number 5, the largest airway, is able to use a 12 French catheter. The manufacturer does recommend to place a lube in the opening of the gastric tube and to prime the catheter before advancing.
If required, a nasogastric tube can be inserted down the gastric channel of the eye gel. For a quick and efficient insertion, it is important that the nasogastric tube and the gastric channel of the eye gel have been adequately lubricated before insertion is attempted. The ideal way to achieve this is to place a small bolus of lubricant over the proximal end of the gastric channel. The nasogastric tube should then be inserted a short way down the channel and moved in and out to prime it before completing insertion. The maximum size of nasogastric tube that can be inserted down the eye gel is size 10 French gauge for a size 1.5, 12 French gauge for a size 2, 2.5, 3 and 4, and a size 14 French gauge for a size 5 eye gel.